I want to take a moment and go to the governor's press conference. I think that's what we're doing now. Governor Abbott has been addressing the state. One of the things that he's mentioned at this point is that schools will be closed for the remainder of the school year. That's one of the things that's come out of this conference. Here's the governor.
Speaker Dennis Bonnet.
Thank you, Governor. And I want to begin by thanking the governor and all of the state employees and the healthcare workers and the doctors who have worked day and night. We are at a positive place because of their selfless efforts. And as Lieutenant Governor said, our senators are working hard, our House members are working incredibly hard, and we're working hard where we are best, and that is in our districts and in our communities, where we are closest to the people we represent. And we're hitting a phase where it is even more important that we show caring and love and compassion for each other than we even already have. As we see pieces of our economy open back up, those of us who wish we were able to maybe be back open in our own businesses have to show the restraint and the respect to those businesses who are able to start operating so that we can continue to beat the virus. And the more successful we are in defeating the curve and beating the virus, the more rapidly businesses will be back to normal operations. But we must do it with respect for each other, and we must consider each other's desires for an open Texas economy. And the more we do that with regard to the guidelines, the more success we will have on a more rapid timeline. Thank you, Governor, for your continuous leadership. He has not taken a breath and has worked day and night for Texans. And he and this great team, Mr. Huffines, and those that you will be leading, we look forward to working and supporting all of you and getting Texas back to being the great Texas that it is. Thank you.
Thank you very much. We'll be happy to take a few questions.
Governor, you mentioned testing. Obviously, that remains a concern for a lot of people who look at that number and see how small of a fraction of the overall population it is. Can you tell us what specific strategies and specific benchmarks you may have going forward as you reopen the Texas economy, specifically when it comes to testing?
Sure. So a core component of the ability for Texas to open up our businesses and open up more of our socializing is going to be tied to the increased testing that we will be conducting. I was on a telephone conference with the President, the Vice President, and Dr. Birx yesterday where we were talking about these strategies. So through that phone conference, through multiple conversations that I've had with the Vice President, through information that I have from our supply chain team, we know the visibility that we have for a dramatic increase in the amount of testing we will be able to do. Not just testing those who may show symptoms of the coronavirus, but also being able to test entire communities so we have better information about what a community setting looks like, about what the infection rate may be. Also, testing strategies where we can identify those who test positive and make sure that they are taken care of in ways that they don't spread that virus to others. We know that until there's an immunization or therapeutic drugs that will be able to treat the coronavirus, this can still spread. As a result, people will have to maintain distancing strategies. We will also need to deploy this testing regime across the entire state of Texas to make sure that we continue to contain the coronavirus.
Is there a specific number of testing, expanded testing capacity that people can look forward to, whether it's on a daily or weekly basis?
In the short term, you can continue daily increases with the information that we have about a massive amount of testing capability coming to Texas by late April or early May. It'll be going up quite a bit.
Until a firm number can be given, should any businesses be able to open up? And what would that look like in terms of just when we'll know the actual numbers, how quickly?
Well, just decisions like what you ask about the ability for businesses to open up will be driven by two things. One is what our medical team advises, and two is what the data shows. If the data continues to show a flatlining and then a decline of the number of people testing positive in the state of Texas, that is a signal that we can begin the process of opening up some businesses that adhere to the strictest strategies that will reduce the spread of the coronavirus. That would mean limiting the number of people within a certain business. It will mean following sanitation and safe standards. It could be wearing masks, it could be hand sanitizing, it could be making sure that you're maintaining distance from other employees as well as from customers. Hence, because we've been going for more than a month now with strategies showing that businesses have been able to provide food and other supplies and products by delivery to cars, by delivery to homes, in ways that contain the spread of the coronavirus, we can at this time safely conclude that such businesses can be expanded throughout the entire retail sector as long as the retail sector is adhering to the same safe practices that we see stores like H-E-B, Home Depot, and others utilizing. With this exception, with the expansion now of retail to go, it will not allow people to go into these retail stores. It will simply allow them to be able to pick up items at a drive-through situation or delivery to their home. With the announcements coming on April the 27th, one thing that our team will be working on collaboratively but expeditiously is to evaluate what other types of businesses can reopen and what are the best standards and practices for those businesses to follow.
As you know, there's a number of legal battles playing out over some of the executive orders you've issued. One of them relates to the ban on most abortions due to the order you put outlawing non-essential surgeries. The new action that you're taking today on surgeries, does that affect the effective ban on most abortions?
Ultimately, obviously, that will be a decision for courts to make. Let me tell you about today's decision. Today's decision, like all decisions, are based upon data and what doctors recommend. The data that was behind the original order was data forecasting that Texas would have strained hospital capacity, strained PPE capacity, and hence there was a need articulated by doctors that we shut down all procedures except for those that were allowed to make sure that we maintain the hospital beds we needed and maintain the PPE that we needed. It turned out in hindsight that we have a great number of hospital beds that are vacant that appear that will not be needed to treat COVID-19 patients. Because of the hospital bed vacancy and because of new supply chain for PPE, we feel that we can begin allowing some more procedures. In my conversations with the doctors before this decision was made, they were very cautious, primarily because of the limited PPE still for current hospital workers. Hence, it has opened up a little bit for more surgical procedures and for diagnostic tests, especially for those who may have serious illness, in ways that we do not think will compromise PPE supply, and in ways that will ensure that there still will remain an adequate number of hospital beds for anybody who may test positive for COVID-19.
So should those additional surgeries that you're opening up today, are you allowing them to include abortion?
That is not part of this order. The way that the order is written is in terms of what doctors write about the type of treatment that is provided.
There's maybe always a chance that businesses may push the envelope. What advice do you have for employees who may be concerned about going back to work in any form or fashion, of whether it's even to go or kind of as the economy starts reopening?
I'll cast that advice for both employees and employers. And that is, it's understandable that employees may be concerned about going back to work. They may be concerned about contracting COVID-19. Employees should not be coerced into returning to work. We need to make sure that our employees feel safe and that employers that are beginning, let's say, retail to go, are employing the very best strategies to make sure that they reduce any possible transmission of COVID-19. So those employers have a responsibility that are set out in that website address that I've identified for you to make sure they are practicing safe practices to reduce the transmission of COVID-19.
Your previous order statewide order telling Texans to stay home except for essential activities, that's, as you know, effective through April 30th. Can you just elaborate on how today's announcements impact that?
All right, and we're going to continue to carry that on our website, christv.com. You can go there if you'd like to see the remainder of that press conference. Again, the big thing the governor mentioned earlier is that all schools will remain closed for the rest of the school year.